All right, my name is Veronica Jacobson. I am the owner of Baby Love in Minnesota. I'm a certified lactation counselor and the Lamaze certified childbirth educator, and the mother of a girl who's now 8 who had a lip tie and a tongue tie, and it made breastfeeding very difficult for the first few months. So I have a guest who's going to kind of talk a little bit about it. He's one of the, I think, leading experts, I don't know, can I say that, on the issue. So I'm going to have him introduce himself and kind of say name and what you do.
Sure, my name is Bobby Gahary. I'm an ear, nose, and throat surgeon in Portland, Oregon. And in a similar way, we had problems breastfeeding our first daughter about 9 years ago and didn't really know a lot about it, and then had a home birth several years ago and had similar problems, and our midwives picked it up pretty quickly, and then we had a procedure done at about 1 week of age on my youngest daughter, and she was able to breastfeed pretty normally after that. So I became interested in the field and basically started working with a lactation consultant here in Portland, and then just started studying my own on how to do the procedure, and has pretty much taken over most of my practice. So that's
Really?
Yep. That's. I mean, I'm probably about 80% babies right now in terms of my clinical load, and so it's something that I really dive into and try to educate everybody that I can. So I frequently speak around the community, and starting to speak more around the nation to try to build a little bit more awareness about the problem.
That's amazing. And I really think anybody who is passionate about this, it's because of personal experience.
Mm-hmm.
Would you agree?
Yeah, I mean, just seeing the drastic difference between my two children and kind of in retrospect feeling guilty about not being able to do anything just out of a lack of knowledge for my first daughter, and definitely it's something that I'm pretty passionate about trying to prevent in people who are having problems, because I think there's a lot of misinformation being transmitted between healthcare providers and moms and babies that I think we need to try to correct.
Yeah. Well, so that kind of segues into my first question. What do you think has been the shift to raise more awareness in the last 5-10 years, or even the last 2 years?
Yeah, I think definitely, I mean, just from a sheer number of breastfeeding moms, I mean, as we've hopefully starting to emerge from the formula years of thinking that formula is just as good as breast milk, you're getting more and more moms who have a real desire to breastfeed. And so just from the sheer number, you're going to see it. I think that there is a genetic component to it. So certainly if parents have problems breastfeeding their kids early on, and that was, in our instance 9 years ago, if we had done a Google search, we may not have come up with anything. Now, because of the amount of information that's out there, it's probably easier to get some information as a mom without any understanding of what's going on. But then certainly part of it is, I think social media has a big part of it. There's a very robust Facebook group about this problem. There's a very good Twitter presence about this problem. And frankly, you have people like me who are, galloping around trying to explain to people like Braveheart that there's a problem here and that there's science here, and that we need to get people who aren't formally taught this in residency and in their lactation training to understand what the problem is. So that's my biggest, I think, the biggest component of this problem.
I didn't think about social media being such a powerful thing, but I mean, that's really what it is. That's kind of how I came across you, was Twitter. So that's a very good point. Yay for social media. So my next question is, what, in your experience as being an ENT, when you talk to other healthcare providers, what's the biggest barrier to getting them to, take the issues of tongue tie and lip tie seriously?
I mean, I think the first and foremost, most healthcare providers, at least in terms of ear, nose, and throat, they're not particularly passionate about breastfeeding. That's not why they went to residency. It's not why they went into training. And so unless they themselves have problems, they really aren't. It's not part of why they became an ENT. There is a small amount of research on it, and we're trained in academic centers. We're taught to examine the available evidence, and the evidence right now isn't really great in terms of the quality of studies that have been done. There are some that are very important, but certainly I think many people will poo-poo this because there isn't a paper that says, hey, you should do this, or hey, you shouldn't do this. And so for some people that paralyzes them. And then the other part of it is if you really get involved in this, it can be somewhat disruptive to the schedule of your office flow, because if you're expecting to see a certain patient and then a 3-day-old needs your help, and you're not the kind of person who's flexible enough to do that and work some baby in, or get them in, it can be disruptive. And so I think there's several hurdles, but that's the main, in terms of ear, nose, and throat, that's the main thing. From the pediatrician standpoint, the family practice standpoint, I think it's just about information. I mean, I think there's a lot of skepticism because they think surgeons want to operate on everybody, and so they're a little taken aback when they have somebody who actually knows breastfeeding medicine. And once they hear the lectures and once they understand the mechanism of breastfeeding, then they may be more accepting of it. And so I've successfully trained people around the area who have an interest in primary care of doing this procedure more.
That's it. The literature seems to mostly fall in the dentists' journals.
Right.
So that that's also really true. And I like what you said about the disruptiveness of the practice. I'm trying to convince a dentist here in Minnesota to jump into it, and I think that's where his hesitation is, because it is, like you said, it is disruptive, although there are dental emergencies too, right?
Right.
Yeah. So in my case, my daughter has a posterior tongue tie, and I do as well. Why do you think it's easy for people to see, the frenulum going all the way to the front? Why do you think posterior tongue ties? I mean, that seems like it's a little bit harder to get people to take seriously. What kind of are your thoughts about why they should be taken seriously?
Well, I mean, in terms of how I practice, I mean, so I routinely treat about 30 babies a week.
Wow.
Every child who has a classic anterior tongue tie, just snipping that little frenulum under the front, which is a very common procedure, really only mobilizes the front of the tongue. And there have been pretty good ultrasound studies that have shown that the more important portion of the tongue that needs to move is right behind that anterior tongue tie. So if where a posterior tongue tie can't move, if it's tethered there, then the mid portion of the tongue can't go up. And so you don't create the vacuum necessary, and then the baby tries to compensate in a different way. So that's the first reason that's important. The second reason is that, in all likelihood, babies who present with breastfeeding problems related to tongue tie, the vast majority are posterior tongue tie. I think there was a very good study done by Dr. O'Callaghan last year where it was a staggering number of babies that presented to his office with posterior tongue tie as the main presenting physical examination finding. So, but because it's harder to find and you have to have a good understanding of why you're looking for it in the first place, it certainly becomes a bigger issue for people who aren't familiar with how to evaluate breastfeeding and how to evaluate tongue motion. So, I mean, definitely I think it's important that basically when I treat every baby as though they have a posterior tongue tie. Whether they have an anterior component or not, it doesn't matter. So in my mind, every tongue tie that impacts breastfeeding is posterior. Some of them have an anterior component that goes forward, but if you don't get through the posterior component, then it doesn't matter. And I use the analogy of a sailboat frequently. Every sailboat has a mast, and that mast is the posterior tongue tie. Some of the sailboats have a sail deployed, and that's an anterior tongue tie. But just because you clip the sail of the tongue tie, if you don't get through the mast, you're not going to get it optimal result. So that's the analogy I use when I lecture.
Wow, that's really good. And if it's not, the focus a lot of times is breastfeeding. If these tongue ties, posterior ties aren't fixed, what are the health issues that show up later on in life?
So, I mean, rarely you get, with posterior ties, you don't really get a lot of speech issues. I mean, there's a certain set of sounds that may be more difficult. Adults will complain of vocal fatigue. It's straining for them to speak. It's a very common thing. Certainly TMJ and jaw tension, grinding, those sorts of things. You can get occlusion problems with your teeth, either underbite or overbite. There's a fair number of people who say that this will cause them it'll be a migraine trigger because of the amount of tension that they carry in their jaw and neck. And so those are the main ones. It's uncommon to have an adult have swallowing problems related to this. Certainly your toddlers can have it, and so I treat a fair number of toddlers who, they just have difficulty manipulating food inside their mouths, and so they have some digestive problems as a result. But those are the main things that I encounter.
Yeah, and my daughter has a tongue thrust issue. So she chokes on food. She's very sensitive to food. And at the age of 8, she's still having issues. So trying to get that fixed. So you talked about there's not a lot of research done in the past. I think I read somewhere you're starting up a clinical trial or a research study. I don't know if that's made up, but do you want to talk about that?
Yeah, so I mean, certainly, I'm also, the nice thing about social media is there's a professional side to it as well. So I'm on a group of professional lactation consultants, dentists, doctors, chiropractors, other healthcare providers involved, and so we frequently try to talk about issues. I'm not aware of any specific other studies that are being started up. I'm getting ready to start a clinical study here relatively soon, and because of my high volume, hopefully I can achieve the numbers necessary to show some significance. So hopefully within the next year or so, we'll have some better data out there to help convince people. But I think until people take this seriously, you're going to continue to get these smatterings of case studies and personal experiences. And while they're reassuring, they're not particularly convincing in terms of people who really, thump the "I want the evidence" drum. They're not really convinced by this. So I'm approaching this study that I'm designing as how to really hush the naysayers when it comes to study design. So we've really spent some good time with a statistician and come up with various questions that need to be answered well. So I'm pretty excited about it.
That is just fantastic. I'm really excited to see how that goes because you're right. It's mostly case studies and like small sample sizes.
Right, exactly.
All right. So last question, last one. Then I'll let you go back to your day. What's your advice to parents who are having a tough time getting their pediatrician or even lactation consultant to take their concern about a tongue tie or lip tie seriously?
Sure, and this is the hardest one because, and you may have seen this meme that's out there where it'll say that a worried mother will do better research than the FBI. And when it comes to a problem out there, moms, especially nowadays, and dads, they're very savvy, and they will find and spend significant amounts of time learning about a problem. And so the problem is if you bulldoze your way into a doctor's office or into a lactation consultant's office with a preconceived notion as to whether your child has problem X, Y, or Z, it can be very threatening. It can be immediately off-putting to the professional. So it's hard to say how you should approach your professional. The best thing I can do is arm yourself with as much information. Certainly my blog is written in a way that is meant to be instructive and not in a panacea, but to explain why these tongue ties affect breastfeeding, because you have to realize I got zero training in residency. Many primary care doctors may get a little bit of breastfeeding exposure, but typically that's normal breastfeeding exposure, not problematic breastfeeding exposure, and so they don't even know how to handle it. So I think it's important to try and realize that there certainly is a sensitivity. I think a lot of people think this is a fad, and so if you bring it up to the pediatrician or family practice doctor, they may immediately dismiss you. And ultimately, if you're providing your information to your providers, and your lactation consultants and you're getting dismissed, then either you have to do what many moms do, which is go somewhere else, drive sometimes hours or fly somewhere. I frequently get people flying in to see me because in their communities there's nobody there, and if they have to decide whether to not listen to their doctor and successfully breastfeed, they're going to not listen to their doctor and they're going to move on. And I've frequently seen moms leave pediatricians' offices because they're being dismissed. And so, the best way is to be calm and respectful and try to be educational about it and hopefully open a dialogue with your practitioner. But ultimately, you have to be an advocate for your family. And then the flip side for the practitioners who may watch this chat is don't be dogmatic about everything. Don't pass on myth and don't just accept what you were taught in your programs, because this is new in terms of our understanding. The ultrasound studies are about 6 years old, so there isn't a lot of time for this to trickle down. Be inquisitive and be open-minded, because there's a very good possibility that the mom and baby in front of you know 10 times more about this than you do. And so there's two sides to it, and certainly you just have to be sensitive that it's a potential problem. And sometimes when a mom hasn't slept for a long time and isn't breastfeeding well, it can become a little bit more emotional. But those are my pieces of advice: is try to keep calm and work as a team. And if it's not working out, seek advice from friends and online, communities. And it may mean that you have to do something that you're not planning to do in the first place.
Wow, that's really good advice. That's fantastic. And I will link to your blog in the comments or in the YouTube description so people can find it. So that's all I had. Thank you. I really appreciate your time this morning and your patience.
Well, thanks for having me. And certainly if anybody has any questions specific for me, I get a pretty high volume of emails from the website, and anyone can really send me a question. But typically within a couple of days I can respond to any specific questions or even direct people to potential people in their community who might be able to help out.
Perfect. Thank you. Yeah, and I'll also link to the Facebook groups as well. That could help people, I think, too. So, all right. That's it. Thank you. And enjoy the Portland weather, I guess.
Yeah. I appreciate the chat. Have a great day.
Thank you. You too. Bye-bye.